the Centers for Disease Control and Prevention announced that they were going to adopt a immunization schedule similar to that that's used by Denmark for childhood immunization in the United States. And what that means is that we will no longer have routine recommendations for all of the things that we were recommending our children be vaccinated against. They did not take away recommendations for vaccine, but they changed many of the recommendations from a routine recommendation for all children to a recommendation that the parents and families have a discussion with a healthcare provider before they receive vaccination against RSV, hepatitis B, hepatitis A, meningococcal disease. This is potentially going to cause real challenges in access to vaccines for many children across the United States. Recommendations for vaccinations are provided by the federal government and also by healthcare professional organizations like the American Academy of Pediatrics, the American Academy of Family Physicians, and others. And we are now seeing a divergence between what the CDC is recommending and what's being recommended by these healthcare organizations, because the decision seems to be made that by certain people in power, that they know more than the science shows us about the benefits of these vaccines for our children. While these new recommendations on paper do not take away access to vaccines to children or to families, they may, in reality, take away access, particularly for those who are vulnerable, who don't have easy access to a healthcare professional. It increases confusion, it increases doubt in the tools that we've had available to us to protect our children for decades. And that's going to cause more people to have doubt about what's the right thing to do to protect their children. And that's a catastrophe as well. This has never happened in the United States. The United States has always used a deliberative, evidence-based process where they review the evidence on the safety, on the effectiveness of vaccines, the acceptability of vaccines to the public, the implications of a vaccination program on the public and on society. Up until this new administration put in a brand new advisory committee on immunization practices. They fired the experts that were on the committee. This administration has decided that they think they know better than the independent science-based experts that made recommendations for vaccination of our children for over 50 years. I think they've ignored a tremendous amount of data and a tremendous number of reasons that we've done what we have to vaccinate our families and children for many years.
Jelajahi cara baru mendapatkan informasi. Download MetroTV Extend sekarang.